Now we will go for details. Action potential. Okay. So now come to the main topic is action potential. So actually, before going to the action potential, what is the potential means? What is the difference? Different membrane potential. What is it? Actually, the potential difference inside and outside of the membrane of the each and every cell is very much important. If you think that a signal transduction pathway is very much important, the membrane potential. That means each and every cell, the membrane potential is present. That is always it is in polarized state. That means the ion exchange or the amount of ion inside and outside is always not in the equivalent state. Always in you can say the difference inside and outside. Okay, so you can say that is membrane potential. That means outside and inside has the potential difference. That means in polarized state. Okay, so when it will be considered as action potential. So always membrane potential is always present and present each and every cell, which are their normal function for the signal transduction and other some releasing factor of some internal content. Okay, so come to the point now. So what would be the action potential? Action potential you can consider as like when the potential difference or potential will just travel. That means when it will be in action, that is action potential. The potential energy is very much important to make some changes within the muscle, within the cell. That is the action potential. That means it will travel and it will just make a complete event. That is the action potential. And membrane potential is just ion exchange. That's like electricity. That means electricity is the flow of electron or the flow ion exchange through the membrane. That is the electricity. So action potential, when the electrical event will just travel. Okay, so that is the action potential, and it's very much important for particular cell and muscle. If you think about the nerve cell, the action potential is very much important, because without action potential, neurotransmitter will never release. Okay, suppose if you think about your cardiac muscle, without action potential, your heart muscle will never contract or never relax. If you think about your skeletal muscle, that will never contract or relax without the help of action potential. And as like a smooth muscle, your blood vessels like that, of course action potential is very much important. And some glands also use action potential for their contribution, as like you can say the beta cell for the release of insulin. Here some action role of action potential. Okay, so come to the point, action potential. So action potential, when I will just discuss action potential, we have to discuss a complete event. So I'm just drawing firstly the basic thing. One is your firstly the resting membrane potential, and then it is the threshold potential, and you can say this is the peak level. And so if I just mention here minus 70 millivolt, this is the resting potential, okay, and minus 55 millivolt, you can say this is the threshold level, threshold potential, and here it is the peak point, peak level, that can be plus 30, somewhere 35, millivolts, and in some particular cases that can be maximized in plus 55. This is highly stimulus way. Okay, so this is exceptional. So here, that is the peak level. Okay, sorry, peak level. So resting potential and the peak potential. So below the resting potential, another potential is present that can be considered as a potassium equivalent potential. And you can mention it, this potential below the resting potential is hyperpolarized state. So I will talk about now one after another. So firstly, without any stimulation, without any touch, or without any activation, the membrane of the nerve cell, the potential difference is minus 70 millivolt greater inside the cell than outside. Okay, suppose if you think this is the nerve cell, and if you just incorporate a microelectrode inside the nerve cell, so you will get in galvanometer minus 70 millivolts inside the cell. That is minus 70 millivolt greater potential or excess potential inside the nerve cell than the outside. Okay, so in resting membrane potential is minus 70 millivolt. In that case, how it will maintain, I will talk about later on. So firstly, this one is minus 70 millivolts resting potential, and this one is your threshold potential, and then it will go up to the peak level, then again it will just come down, and again it will reach to the resting potential, and then it can reach below the resting potential and this way. Okay, so you can just give some name of the event. Okay, this is the resting membrane potential, how it will be maintained, the resting membrane potential, and before reaching to the threshold potential, the potential difference is there, and what would be the terminology for that potential changes, and what would be the terminology for that region and that region. Okay, so now I will talk about that. So firstly, so without any stimulation, suppose your nerve is in rest, so no activation. So when you will activate, then what will happen? The activation or stimulation must be optimum, because nerve cell follow all or none law in regarding action potential. That means stimulation must be optimum, and that will create action potential that will reach the threshold level, otherwise it will not work at all. Okay, so before threshold level, by some your leak channel or by some your mechanical sodium channel, here some potential changes may happen. And you know, already I said the membrane is always in polarized state. That means some extent ion is already just already enter or exit. Okay, so resting membrane potential is minus 70, and here when nerve is just slightly touched or pressurized, and it will just can increase the potential towards the positive. Okay, minus 72, like that, like that. It will just if you think you will touch the membrane of the a nerve cell, and then mechanical sodium channel will open and some sodium will just enter. Then what will happen? Now, when sodium will enter, the potential change will occur towards the positive current, okay, but it will not reach the threshold. So actually this current or this potential changes is meaningless. So what is that? These are the graded potential, okay. You can say these are graded potential, or you can say these are this is basically sub-threshold potential, sub-threshold potential, because the stimulus is somewhat less extent to reach the threshold. That means some touch or some pressure or some mechanical just mechanical stimulation that will open the touch sensitive sodium channel, and some sodium will enter, and then it will change some potential, and that will never reach the threshold, and that is the sub threshold, and that will, when the potential change will occur towards the positivity below the threshold, and that will happen by the entry of sodium, and again it will minimize to the resting potential, like that, okay. So this is basically happened by the leak potassium channel. Already I said potassium channel is always open, leak potassium channel. So that through this potassium, so some potassium will exit. So sodium will enter by the mechanical sodium channel, and potassium will exit through the leak channel, and it will balance. That means some extent it will increase and then decrease, then increase, then decrease, but that will vanish, okay. So this is the graded potential or sub-threshold potential, okay. Then what will happen? If the stimulus is optimum level, if the stimulus is sufficient to create action potential, that means that will reach the threshold potential, then what will happen? Okay, so without reaching the threshold potential, action potential never start, okay. So here the when you will just activate or stimulate a nerve. Suppose this is the nerve cell. When you will just stimulate live through the fire, then what will happen? The potential change will quickly reach to the threshold potential, and when threshold potential will reach, then the voltage gated channels will open. The voltage gated channel already I discussed, that is voltage gated sodium channel and potassium channel is very much important uh, to initiate the action potential and to maintain the action potential, okay. So from here the voltage gated sodium channel will open through this, okay. So actually I'm just discussing different parameters, but in resting state, what is the membrane condition of the potential or ions inside and outside? That is already I missed out. So just I'm just drawing here. In the resting membrane, resting potential, that would be the right place to just draw a resting membrane intensity of the action potential, sorry, intensity of the potential difference. This is the membrane. In normal, that is in resting state, outside of the nerve cell, sodium is very rich. Sodium, okay. That means outside of the nerve cell, sodium are very rich outside of the cell. That is potassium. You can say that is potassium, and some chlorines are there. Chloride ions are there. Okay, so sodium is very rich. Okay, and inside the cell, potassium is very rich. Potassium is very rich. Okay, and some sodium there. Okay, so you can say in normal resting state, outside of the membrane, sodium is very rich than the inside, and inside the cell, potassium is very rich. Okay, so the overall intensity of the potential is the membrane. Outside of the membrane, the current intensity is positive, and inside is negative. Why it is like that? If you think sodium is also positive charge and potassium is also positive charge, so why the sign of the electricity outside of the cell is positive, or intensity of the potential inside the negative? Why? Because the number of sodium is higher or very larger than inside the potassium. That means number of potassium is very less as compared to the number of sodium outside of the cell. Okay, so positivity is greater than inside. So this is positive. Another thing is that within the nerve cell, some negative factors, negative charge are there. That means if you consider as a protein is negatively charged, so that will maintain the negative intensity of the potential inside the cell. Okay, so here I just want to say, in resting state, outside of the cell, sodium is very rich. Number of sodium is very higher than inside, and the intensity of the electricity outside of the cell is positive and inside the cell is negative. But the sign of positive and negative does not mean positive current or negative current. Electricity has no positive or negative. Actually, it means the intensity of the potential changes. Okay, so now come to the point. So here, when the threshold stimulus is very strong and it will reach the threshold level, then what will happen? The voltage gated like that. You can say there is a voltage signal like that. Voltage gated sodium channel will open. So what will happen? Voltage gated sodium channel will open. So voltage sodium channel has some gate, the activation gate, inactivation gate, but I will not go to the details about the voltage gated sodium channel, but I will just focus on the role of the sodium channel, voltage gated sodium channel in action potential. So what will happen when the threshold level will reach by the stimulation, then voltage gated sodium channel will open. And what will happen, as sodium is more in outside of the cell, then that will enter through the sodium channel, voltage gated sodium channel. That means sodium will enter. Sodium will enter. Sodium. Okay, and the potential changes will just happen toward the positivity. That means that current will be called as depolarization. Depolarization. Okay, that means depolarization potential or depolarization current will produce by the entry of sodium, because at the threshold level, voltage gated sodium channel will open and rush of sodium will occur inside the cell from the outside, because through the voltage gated sodium channel, sodium will enter through this channel and it will cause the potential changes toward the positive way, and that will make depolarization. That means depolarization will happen through the entry of sodium through the voltage gated sodium channel. That's it. Okay. And what will happen? It will just reach to the peak level. That means maximum positive potential. That is the peak point. Okay, and that can be 30, somewhere 35 it is mentioned, and it will be maximum, that is plus 55 millivolt. That can be considered as a sodium equivalent potential. Okay, so after reaching to the peak level, then what will happen? Instantly the sodium channel will close. Okay, sodium channel will close, and then what will happen? The voltage gated potassium channel will open. Voltage gated potassium channel, that is voltage gated sodium channel, that is voltage gated potassium channel. So here voltage gated sodium channel will close, and then voltage gated potassium channel will open. Okay, and as you know, inside the cell, nerve cell, potassium is very number of potassium is very much than the outside. So what will happen? Through this voltage gated potassium, potassium will exit, potassium will efflux. Then what will happen? The intensity of the action potential energy will just decrease, that is, it will just go towards the resting. That means your nerve cell will just try to become, the potential changes try to become a resting level. That means it will just again go to the rest. Okay, so the resting the potential changes will just go toward the resting membrane potential, and that electrical just potential changes is called repolarization. That is called repolarization. Repolarization. So again, simply, what will you say? What does it mean, repolarization? Repolarization means through this voltage gated potassium channel, potassium will exit. And what will happen? When potassium will exit, the potential changes will go towards the resting level, and that is called repolarization. That means repolarization will happen by the exit of potassium through the potassium voltage gated potassium channel. Okay, and it will just reach again to the resting level. So from here to here, this is the repolarization, and from threshold potential to the peak, this is the depolarization, and this is the depolarization, and this is another potential, this is the repolarization. So depolarization will start from here and repolarization will start from here, and it will end in the resting potential. Okay, so this is the depolarization, this is the depolarization, and this is repolarization, and actually this is called action potential. Okay, this is called action potential. Okay, because in that way the potential changes, the potential energy will travel. Action potential. Okay, so this is basically truly this is called action potential. So what does it mean, action potential? Action potential means depolarization and repolarization. But that after reaching to the resting membrane potential, that can go backward, or that can just change the way where it will start the potential. So here some some changes will happen below the resting membrane potential, and that is very crucial. That is called hyperpolarization, and this is very much important because it will prevent the backward potential, and it will also maintain the accuracy of the action potential towards the next one. Okay, so this is the hyperpolarization. Hyperpolarization means when your electrical potential change will happen below the resting membrane potential, this below. Okay, so you can say this. Okay, that means from resting membrane potential to potassium equivalent potential. This is the hyperpolarization. So what does it mean, hyperpolarization, and how it will happen? Hyperpolarization will happen through the leak potassium channel, as I discussed earlier. That is leak potassium channel. That means through the leak potassium channel, some potassium will exit, and then it will just go below the resting membrane potential, because at the when it will just reach to the resting membrane potential, the voltage gated potassium channel will close, and you know the leaky potassium channel is always open. So through this channel some potassium will continuously exit, and that will cause hyperpolarization, and it's very important, hyperpolarization. Okay, so this is the hyperpolarization, and that hyperpolarization can happen through another channel, that is ligand gated chloride channel, that will I will discuss when the conduction and the application of the action potential over there. But here basically when action potential repeatedly happen, so uh, in very few millisecond hyperpolarization can happen as the refractory period. I will just talk about just after this action potential. So here is the uh, hyperpolarization. So that this hyperpolarization will just go just below the resting membrane potential. That is hyperpolarization. So if you think already this is hyperpolarization, and that potential energy is minus 90 millivolt. That is minus 90 millivolt. Okay. Okay, then what will happen? This minus 90 millivolt here already reach the, you can also consider as a potassium equivalent potential. Then what will happen? From this point, the potential change will again reach to the resting. That will again it will go to the resting membrane potential for further stimulation. Okay, so who will maintain this part? That will be maintained by the sodium potassium ATPase pump. Okay, sodium potassium ATPase. Okay, sodium potassium ATPase. This is the touch sensitive sodium channel. This is sodium potassium ATPase pump, and this is voltage gated sodium, this is voltage gated potassium, and the voltage gated potassium, and this is leaky potassium channel. Okay, So already I said here what will happen. The sodium potassium pump that will maintain the resting membrane potential. It will maintain the resting membrane potential, and through this hyperpolarization it will maintain. How? Because through this sodium potassium ATPase pump, 3 sodium will exit and 2 potassium will enter, and that will maintain the resting membrane potential. Okay, so hyperpolarization is a part of action potential or not? So you can consider as a third phase of action potential, hyperpolarization. You can consider hyperpolarization is a part of action potential as a third phase because it is very important. Already I said it will prevent the backward potential, also it will maintain the accuracy of action potential towards the next one. Okay, so this is very important. So some scientists consider that hyperpolarization is also a part of action potential. But actually, action potential means the potential energy will be in action. Okay, so that truly action is basically depolarization and repolarization. Depolarization and repolarization. This is the truly action potential because this potential energy is in action. But here, below the resting potential, if you consider as a you are in a resting state, that means you are taking rest. But if you go below the rest, then you will go for the sleep. Okay, so when nerve will be in some extent it will inactive, that is hyperpolarized state. So it's a very that is for very few millisecond. That is the another issues, but hyperpolarization. So you can consider hyperpolarization is also a part of action potential. But truly, action potential means depolarization and repolarization. Okay, this is the action potential. Okay,